My first guest is Dr. Paige Quintero and Dr. Derek Weiss, who are bariatric surgeons at the Baptist Hospital. Welcome.
Thank you.
Thank you.
All right, now, the best way to lose weight is diet and exercise. Sometimes that doesn't work, and we go through a whole lot of things and end up with weight loss surgery. Now, there used to be different kinds, or there's still different ways, Dr. Weiss, to operate on people?
Yeah, there's several different operations, and the field has evolved over time. About a decade ago, we did these things called lap bands, and we've gotten away from that, and most of the country has as well. They just didn't get the results we were looking for. Gastric bypass has been very popular for years, but we've gotten away from that too. There's a newer procedure we've been doing the last 5 years or so called the sleeve gastrectomy. You don't reroute the intestines, you don't put any foreign bodies or devices. It's your own stomach smaller. And the results have been fantastic, and people don't get sick, and they don't have vitamin deficiencies. They can tolerate all food, so it's been a real boon for the field.
Now, Dr. Quintero, I think we brought a video of the actual what happens during the surgery. So kind of describe it. It's laparoscopic.
Yes. Weight loss surgery in 2017 is laparoscopic. That means through small holes. This is a minimally invasive surgery. It's much easier to recover from. You can see on the video that we put some ports in the abdomen and we insert some long instruments on sticks in. And then there's the GI tract. And this procedure involves cutting and dividing the stomach. You can see the stomach that you start out with is very large. It can hold about a football's worth of food. And in the sleeve gastrectomy, we staple and divide the stomach, and we reduce the volume by 85%.
To a baseball size from a football.
Or like a banana,
Okay.
yeah, about like a banana. And in this video you can see there's no rerouting of the intestines. Food goes through the normal way. You just can't eat as much.
Well, now you mentioned that you just can't eat as much. So tell me, Dr. Weiss, what happens after the surgery? Can you overeat it? Do you have to only eat certain things?
Well, some things people ask are, can you stretch it out? And the answer is no. It stays small. You keep the valve at the end of your stomach that keeps you full, so it's a long-term solution. It's uniformly successful. Everyone loses weight. They lose a lot of weight. You lose it pretty quickly. The average weight loss is usually about 100 pounds at 6 months. And you know, you've seen a big trend now among celebrities. Rosie O'Donnell had a sleeve recently. Mariah Carey just had a sleeve. So it's become sort of the mainstream operation. In 2013, it became the #1 bariatric surgical procedure done in this country. So it's really changed the field quite a bit.
Now, Dr. Quintero, who's a candidate for the surgery? Do you have to weigh so much or have certain diseases?
So we don't usually go by weight. We really look at the patient's BMI, which is body mass index. Most insurances are covering sleeve gastrectomy for patients with a BMI of 40 or greater, or with a BMI of 35 to 39.9 with some medical problems associated with obesity, such as type 2 diabetes, high blood pressure, sleep apnea.
Now, those are the simple things, the sleep apnea and diabetes, but there's also the weight can affect back pain and joints.
Absolutely. Arthritis, migraine headaches, reflux. We repair quite a few hiatal hernias. And speaking of insurance, the Medicare and Medicaid cover it. A lot of people want to have this insurance and think, well, I can't have access. My insurance won't cover it. But they do cover it because it helps all those medical problems. It's not a cosmetic procedure.
It's actually the cosmetics down on the list. It does.
That's right.
You know, I've had some patients that you guys have operated on, great outcomes. I mean, they were on diabetic medicines and all of a sudden they're not. Is that your experience?
Yeah, there's a lot we still can't explain how you can be on insulin and leave the hospital off insulin and you haven't lost any weight yet. So there's still a lot the field hasn't sorted out, but it's a nice thing to have happen.
So, Dr. Quintero, how long does it take to recover? They back to work the next day or take a few weeks?
Not quite the next day, but most patients do leave the hospital within 24 to 48 hours. I would say that the time off work can vary from 1 week to 3 weeks, but you are walking within 2 hours of surgery, you're eating the next day. This is a huge change from some surgeries that we used to do in the past where they had a large incision. Those small laparoscopic incisions are so much nicer with recovery, and people really are back on their feet and feeling well in no time.
Dr. Weiss, so there's people that are not candidates for surgery.
Well, everyone has to go through a psychological evaluation. We're a center of excellence, and certain things are required by insurance. But you have to qualify based on your BMI, and then for medical reasons. Some people are, you know, if you can't get cardiology clearance, you might not be a candidate. But we do some pretty sick folks. I did a lady on the heart transplant list this year, so she could lose weight to get her heart transplant. So we'll look at just about anybody who applies.
That's really great information. You guys really do a great job, and from a medical standpoint, it really is amazing. Thanks for coming in and telling us about it.